And Grace works here. We also work in other facilities. You can sit down here and join us or eat. So we are home health agency. We come to homes, we come to assisted living, and we work together with family and who are caregivers. At home, because we are not supposed to be like going there on a regular basis. There's a reason why we're there, medical necessity, so we can intervene. But some of our elderly, 80 and up, if you stop encouraging them, doing the things that they are supposed to do, they will decline. So you would see us seeing them on a maintenance program for once a week. But as much as possible, those days that we don't come, we encourage you to continue letting them do what they have to do. Most of the time, we want them to, oh, I have to get up everybody, 10, I have 10, we just, okay, just don't make, my neck, I will pick you up and everything. Then they got the point that they will rely on you to do all of that. And in due time, your body will give out. So the thing that we're gonna cover today is, we have a lot of topics that we have to cover. It's proper body mechanics, safety with transfers, bed mobility, prevention of bed sores, contractures also, then the DME. Those are requirements when the ACA comes here, they check. That's why you see equipment being labeled, because it's part of that one, and making sure those equipments are in good working condition. Come on and eat or sit, whatever. Making sure that those are not faulty.
I will just eat. Sisig-sabi akong pagkain, ha?
Get food, whatever. So, making sure that those equipments are not faulty, that the bottom of those things are, they have rubbers and everything. Because if something happened to that one, when they come and survey or there's an incident, and then reason of that fall or reason of injury is because of usage of that faulty equipments. And also I will touch base with the new requirements now, how to determine like DVT. Governor DeSantis make it a point that we know, because anybody, not just our elderly, can develop that. As we can develop. One of our nurses have that. They're active and everything, and she has that DVT, and then it travel all the way to the lungs, like pulmonary embolism, or it could cause heart attack or anything like that. But most likely it's seen on the legs. So we have so many things to cover. So the first thing with body mechanics is deep venous thrombosis. Yeah. So I'm just gonna glance on my cheat sheet. So this is not just for here. It's applicable for you when you're at home, you're climbing ladders, you're doing something, you're cleaning, your furniture is anything that involves, you gotta be lifting, you're gonna be pushing, you're gonna be cleaning, mopping floors and everything. Anything could happen if you're not doing proper body mechanics. If you're in the housekeeping, not necessarily that you're lifting people and hurt your back. You're pushing, you're twisting, all those things could cause you to, that's why it's important. Start the day, the condition, I'm not very good at exercise. But it's a good thing that you have good exercise, flexibility and all that. As we age, our muscles, our tendons, our ligaments and everything are not liable anymore. So, what do the runners do? They do stretching, okay? Even though we're not running or anything, but we are prone to have that. So it's a good thing that you will stretch your hamstrings, do a little bit stretching in your trunk. You could see some YouTube and everything, but be mindful of, not all information out there is 100%, some people have that. So, the basic ones, you don't have to touch your toes or something, especially if you're 50 and up, because the next thing you might not come back up. So you can do some stretching without doing that, because with that, your body weight and everything, you can do when you're sitting down, you're in the bed, or things like that. So go for those things. So start the day with stretches. So hand hydration. You have to take care of yourself before you can provide a good, care for somebody else. Because caregivers, sometimes you forget ourselves. So take care of yourself so you'll be efficiently providing the care to somebody else. So hydration, getting enough sleep, stress can cause a lot of chaos in our, So walking is a good thing. So, those are things that we have to take care of. So when you're pushing or lifting, make sure you have to use your thigh muscles, okay? And good shoes. You'll be on your feet a lot. Don't buy those branded fancy shoes or anything like that. It doesn't, the good shoes has to have good soles and then non-skid. So, when you have to run or, quick movement or something like that. So make sure you gotta use that, because I have seen some nurses and everything that works in the hospital for 16 hours and they complain about hurting feet. I said, invest on those good shoes. Not necessarily be a branded one, but those shoes that you're comfortable. It's not too tight. It's not, but when when you buy one, just order one and then figure it out. So you gotta try them on, walk it off and everything. So good shoes is important. So when you're lifting, you make sure if it's a box of, a sack of rice or something, okay, you gotta spread your legs apart, because it's a difference when it's narrow. You're gonna kind of like, you're off balance. So your shoulder and your feet should be, squared parallel to it. And then right there, lift it. And if you have to bring it somewhere, do not twist, okay? Because a lot of injuries are caused from that one. You're just in a hurry until I feel my back. So carry it and move your feet, no twisting. Face where you are going to take your, or a person or something like that. And then when you're pushing, you push like far away, okay? Close to it. Use your body weight when you're pushing something, okay? And always use your judgment. If you're petite like Christina, she cannot do 200 pounds. She cannot lift it. You have to use your judgment. If it's beyond your body weight, beyond you're capable of, and you're not a weightlifter, so don't attempt. Always judge what you're about to do. If Mr. Gene is 200 pounds, he can help, but if he cannot help at all, it's dead weight, 200 pounds. So think about yourself, okay? So, and then sitting, sometimes we're tired of our shift. You slouch out, you sit, you're sitting on a tailbone. Everything tires out. Your butt, your lumbar, because our lumbar has a normal curve here and here. If that one gets so like that, problem. If it's flat, problem. So make sure it has the normal curve there. So, and then if you have back problems, the first thing, if something happened, report to your supervisor, because sometimes you claim like, I stumbled last week and you didn't have incident report. Sometimes you will get the workman's comp or something, right? There's a time, even if the car accident, you're not gonna wait till you have it after a month. There is a time frame of reporting. So make sure, things like that, you report to your supervisor, anything about that. So sitting, if you are doing desk job, sometimes in the computer, then you're wearing bifocals. It's a lot of work because you're gonna do, your neck gonna be straining like that. So so make sure you get up and and do some chin tucks. Okay?
The doorbell rings often enough that I get up plenty.
Getting, especially like if you're in a, call centers or something, that's why they adjust those. Nowadays they have those high-low the table, so they can still do their work standing up. They can do, not unlike before that you'd be like this all day long and all that. So, reposition. But us, since we walk around and everything, but that's the thing, posture, it's important that, you evenly distributed your weight, not just on your sacrum. So when you're sitting, because you're slouching, you're leaning, you see a lot of residents doing like that, or sliding out of the chair, everything hurts in their back because of that prolonged sitting poor posture. Okay, so the thing is, when you're carrying something, bring it closer to you. Okay, don't be carrying something like this, because you're straining your neck. You feel it at the end of the day. Here hurts. So if you carry it towards your body, and pushing and pulling, use your body weight and get closer to it. And transfers. So us, we use gait belt. Do you have gait belt in Medcard or something? I've been giving that. So, but I give personally to Jano. He's got one in his cabinet thing. So especially those very hard ones. And we have some families that's like looking, there might be friend lands. And some people are just looking for mistakes. So, and that's why we're very careful, because when it's gotta go litigations, suing and everything, they will magnify everything. Okay, they fall, how they carry it. You got a bruise in here, all that kind of stuff. What are the measures that you did to prevent those injuries and stuff like that? So, because elderly, in the memory, they cannot tell you where they hurt. Okay, or don't assume. Assuming is not a good thing, because I told her not to get up. She won't remember what it said. So that's why it's important that we have to know their body language, their gestures, how things are, if they're hurting, or because normal day we see them, and all of a sudden, we have to prevent them getting sick as much as possible, because there are things that can be prevented. UTI can be prevented, dehydration can be prevented, but it got to the point, some of them you're like, oh, fever. Most of the time they won't run fever anymore, but they're not eating, and some, they will hurting, they can point out to you, or they just have the, you like, when you're changing diaper or something, it's like very strong odor. Those are signs of possible infection. You're very dark. So those are the things. And then they are being more confused. Altered mental status. So you go to the hospital with altered mental status, then they're in urinalysis, then they find out they have UTI. So those simple UTI can prevent them from going there. We encourage them hydration. Okay, let them drink. Do not ask them, do you want water? Of course, they're like, no. Some of them like, even they want to, just, offer it. Let her drink. So that, because just imagine how many, if you're a med tech, all the pills that they have to take, all the side effects and everything. So you will work together. Some of them will be loopy, sleepy, So make sure you hydrate them, because that's based on the hydration. If they are not hydrated enough, the potency of the medication is more for that 24 hours. So it's supposed to last. There are medications that extended release. There are medications short term. So make sure that we have enough hydration, except for those patients that are measured. The one with diagnosis of congestive heart failure, CHF, those are measured. Or somebody has go dialysis. They have a limit of how much they can drink. But other than that, if there is no restriction, encourage them to drink. Hydration is important for all of us, even us. Because I notice when my joints are aching and everything, when you hydrate, instead of getting Tylenol, hydrate first. Because it could be your body telling you there's something wrong instead of just masking it, boom. Because if you consistently take Tylenol, the side effect is going to your liver and all that kind of problem. So your first defense is hydration, okay? So with transfers, we use gait belt. So the gait belt is designed to be long because sometimes we have patients that are big. So like a belt, you know, it has a teeth. Because if you put it this way, you know, it will not lock. By the time you grab and like, zoom, it just come off. So always remember that it has teeth. Like your belt, it has a hole or something. So put it around here. And then it depends on you are putting it sitting down. So you might have to readjust when they come up, okay? For ladies, we're here, nobody has suprapubic or fitting tube or something. If you happen to see people that have that at home or relatives or whatever, do not put it under those tubes. Because most likely they will zoom. You're gonna go back in the hospital, put those tubes back. It has to be above. And for ladies, not on their boobies, okay? You might have to raise them up and then put it right there, not on them. Because by that time, like, you'll be squeezing them and it'll be so uncomfortable. So put it right there and roll it back. If it's too long, what I do is like, some of them, people like, you know, they're like something in there, so I put it in the back. If it's too long, I kind of tuck it in like that, out of the way, and put it right there. So, because they like to fidget, touch things, and they will be, you know, you'll be holding them, and they'll be doing like this. So, and then when you're using it, not like this, okay? Under, put your hands under. So just in case legs buckle, you got them like that, okay? Instead of like this and buckle, you lose them. Okay, so that's the thing. So when something, if somebody have, this is one of your, to cover you, okay? If there is like investigation, somebody's blah, 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 hopefully not, but this will prevent you from like, what are the things that you did to prevent that kind of injury, just in case, you know, she fell or something, you were using gait belt in the process of transfers and stuff like that. So with transfers, make sure you have to know which one is a good side, the stronger side, if they have stronger side, or missing leg or non-weight bearing something. Always transfer towards the good side, okay?
Okay.
So you have to adjust your wheelchair where it's facing, that it will be towards where you're going. You go, if in a wheelchair, you're going to the bed. If the right leg is the stronger one and the other side is the weaker one, so always transfer towards the good side. So this is the bed and your strong side is on the right, so the bed like that and the head is over there. Your wheelchair should be facing the head part, okay? And the purpose of the wheelchair, is that a wheelchair? Okay. Every part of it has a purpose.
It's kind of broke ass, but
Who's
I don't know.
in the world?
I don't
They
know.
go outside.
I don't know, baby.
It's my first time that the chair is
Squinty.
like that.
Drop all.
That was, which culture?
Fairly.
That's not really powering. This is for silver treasure. We just let her use it, and when she has a loan,
This is the loaner. I was wondering if they've been using marathon some.
and she's heavy. That's why. And it's
But
old.
this one?
It's really old.
Okay, so this one, there's the standard one. There's are those for like base one, and the arms normally come off. So it's either swing out or completely come off. So those people who cannot stand up at all can do modified sit pivot. So the brakes has to be the most of the crucial thing is that people are not putting the brakes on, and they're getting up if they're transferring themselves, and the moment they get up and they did not lock it, they do like this number and it rolls back. Boom, where they gonna be? In the floor. So we always tell them, make them a habit of learning how to lock the thing. And then for those memory patients, you know, sometimes you have to repeat, because they don't have to like understand. You know, that's why we do repeat exercises, how many times and everything and all that, and repeat the same pattern. Because once they learn it, they don't have to think. It becomes automatic. Like we do when we get up. We just get up. We don't have to think, oh, I have to put my feet down. I have to, you know, it becomes automatic. So for those with dementia, Alzheimer's, it's a lot of repetition. Okay, not really like you tell them this and you want them to process. Sometimes they don't have processing anymore.
Right.
You just have to. So whatever we teach them, we try to get you all that we would all be doing the same thing. So that eventually, you're like, with us, they will do this. And then with you, they'll do the other thing. So there is no continuity. So we cannot, a habit to be formed, it has to be repeatedly done in a month to become a habit. So if to formulate that kind of response, we have to constantly doing that. So the thing is, okay, this is the bed, head part, foot part. I cannot, so I would say Judy is the worst part. We go to a little bit easier ones, okay? So if somebody come here with a broken hip, okay, what we're looking for, especially if it's fracture and they just do open reduction internal fixation, that's the one that they put plates or screws in. That we look for weight bearing status, okay? Because not necessarily that they have surgery that they're fine, because some of them come here with a non-weight bearing order. That means they cannot put any weight at all, okay? Especially if they don't have here, because even with the have here, if they're very weak, most likely they still can put, you know, weight on it, regardless. Because the thing with that, because it can mess up the screws in the whatever they put in there. Because it's a transition, at least about every 4 to 6 weeks before they change to partial weight bearing and all that kind of process. So when they come here with non-weight bearing status, make sure that you know that, okay? So we encourage them, it depends how much, you know, they can do. That's why we come here and assess. And they'll tell you, okay, this and this, and some of them come with a brace, just to make sure that they're not gonna use that. So they have those knee immobilizers that will stick their leg out like that, and then we have to let them learn how to kind of like this, okay? So if, well, this is my good side, this is my broken leg, non-weight bearing, so this is the bed. So we also have like a sliding board, if they're able to use that one. The sliding board, they don't have to get up, okay? So you release this thing, bring it out, put the, do you have the sliding board here?
No.
I think you have one. They have one here. Every building should have one, but I don't know if you ever use it. But you can, Miss Jones, lean over there, and you can put that thing there, and then they can just like, you know, one, you know, at a time. Just slide over there and scoot until they get here. Always towards the good side, okay? So if it's not possible, the room is too tight or anything, you gotta make a point that maybe you have to rearrange the bed.
Right.
You know, maybe facing that way instead of by the window or something, so that you have enough room for you to, you know, get on. Okay, this is
Put
the,
in the side of the med cart over here.
Okay.
so this is the sliding board. So to use this one, you see the slant, incline, or whatever you call it. So that's the top side, okay? Do not use like that. That's like that, okay? And then, okay, Miss Jones, if this is the butt, whatever, something, kind of let her lean over there. And then, so So they will be even. So make sure the bed and the wheelchair, wherever she's transferring, will be the same level, because it'll be hard if it's lower and this like that. So make sure that the bed also works, the up and down and stuff like that. Okay, so and then like, okay, Miss Jones, okay, let's go. And what you could do is you got a gate belt here, and then assist her with that. Okay, and account. Oh, make your instruction not too much, but you'll be coordinated. Okay, in a count of 3, let's get up, like sit to stand. Okay, in a count of 3, 1, 2, 3, up. Okay, so give them time to, you know, to understand or whatever. And also encourage lean forward. Okay, Judy is backwards. It's very hard. I'm working on it to be upright. But okay, lean forward, and then this is the back leg. Okay, 1, 2, 3. You lift her there, and then at the same time she'll be doing like this. 1. Okay, slide, slide until she gets here. Okay, and then lean over this way, Miss Jones, and then you take that out. Okay, so that's for the sliding, if they cannot stand up. Okay, so if they are able to, if they will not fit there or something, and they still have good upper body strength, they can do modified sit pivot. Okay, granting she can put weight, she's not fractured anymore, she can put a little bit, but this is weak stroke patient with this. Okay, make sure their legs are in place. Because sometimes they have their legs like this and like that, like, come on, get down. And you know, or like this, where the position is, because if it's like somewhere sticking around, you know, going like this, the foot will be twisted. You might have a sprained ankle or a broken ankle or something. Make sure the legs are out and clear where you're going, okay? Not like stuck there, because sometimes they stick it there, you know, it's either they twist their knee or something like that. So make sure that it's clear. So with the process of sit pivot, okay, that's 1, 2, 3. If she can stand up, then she can use this. Okay, let's stand up, this 1, 2, 3, up, and then turn, and there. So your support, you're just like 50-50, it's a modified assist. And then if they cannot do it all, that they can just like, okay, 1, 2, 3, okay, up, and they can do, don't let them grip on this chair. Because once they're up, they tighten up, and then you will not go anywhere.
Right.
So make sure if she can reach to the bed or something, that's where we're going. Okay, 1, 2, 3, this way and over. Okay, so because they have fear of falling. Once they grip on something, you cannot let go. I mean, they hold on to you, then you'll be stuck with that one. So, what else?
You know, Mildred, its right leg is fractured.
Old
She
fracture,
can
new
stand
fracture.
and She can stand up.
Is this the new
Both
Mildred?
legs are weak.
New Millie?
Yeah, both legs are
Transfer towards the strong side.
The right leg has surgery or
Okay.
bone.
And she can stand up to
She
go
can
bathroom or
stand,
something, yeah.
Sometimes she doesn't want to help.
But you have to be there.
Both legs are weak.
You
Yeah.
can,
Both legs are weak.
No, the right leg.
it's
But
not
she
a
can-
broken one.
Millie, the new Mildred.
Mildred.
She can stand up because
Yeah, she can stand.
I got her like standing
This
up.
leg is
Yeah, that's why they're receiving therapy to kind of get them hurt. But you know, even though like I can do it, like no, you gotta be here at least if, just in case. The standby by assist is you are ready. You're not just there looking at her when she falls. You are 50%, you know, ready to because their legs sometimes give out anytime. Or maybe they feel numb, or like us, like you squat for so long, when you stand up, you know, you can hardly move. So the hardest thing is when they're getting stronger, they thought they got it, that's when they attempt to do it on their own. And then when we're back to square one, because they fall again, all that. So, so baby, I will let you practice each other, that group, and you and her.
Oh, who? You what?
Get up. Get your partner. Huh? Yeah, pretend where your bed, position,
What we doing?
and the wheelchair transfers.
You gonna transfer?
Oh, okay. I'll transfer.
So who's the most hard for you to transfer that you
You're in a
know?
wheelchair. You're gonna beat me. Yes, girl.
Is she gonna be Millie? Let's pretend or whatever.
Oh, which leg is this leg is hurting you most, or this is the weakest one? Or her?
Okay. So we'll pretend she is Judy. What? No, Judy's difficult. We'll go with Judy last. Judy's last. Wampler? Miss Mildred. Okay.
Yeah, that's what
Miss
they're talking
Mildred
about.
can stand up. She
Okay.
probably like mod assist. Moderate assist. Okay, she's not max assist. Max assist, it requires all of your strength. It's like
Yeah.
whatever, 90% of your strength to help her out, and she will do the patient do 10%. So that's max assist. Total is you don't do nothing. You probably take 2 people or something. Okay.
So pretty your whole meeting?
So if you do together and you do together, you will be fast too, because we have so many topics to
Which
cover.
middle you want me to read? Thank you.
Yeah, this minute.
Okay, you know the other,
Okay.
which Millie,
This Millie.
I don't know, is Millie that
W.
one still can
Millie
stand up?
W.
Yeah, she can stand up.
Okay, you Millie Walker and you Millie,
Hilaire.
what's her last name? The other
Juan.
Hilaire.
One
Claire. She's me Claire.
Oh,
She's Walker and
Walker.
Millie, what's the other
No,
one?
maybe it's easy.
Hilaire.
I forgot her name.
Claire.
Oh, Filari,
Yeah,
yeah,
that one.
it's Mary Filari. So you are Millie Filari and, we might have to go
Yes,
this.
this is me.
Mary Filari, Mary Filari don't have any here. No here.
I have to read
Millie Walker, she still got hair, so Millie. So you probably provide more of tactile, like more touching and all that to the direction what you want her to do, because Millie don't understand. But you just have like Millie, we gotta get, more of like sign language or something with Millie Filari. Millie Wampler, she still understands.
Okay.
Okay, what you gonna do? She's in the wheelchair, what you gonna do first?
Okay.
We'll start with the wheelchair.
This is your.
Okay, pretend we have footrest and everything, what you gonna do?
Okay.
Because most of the time, the reason of skin tears are the skin
The wheelchair.
from the wheelchair footrest.
Okay, I will
So
transfer
you have to
the-
remove the footrest
Okay.
and put it out of the way that nobody will stumble on it.
Okay, footrest.
Okay, and next, after removing the footrest, you're gonna what?
I will.
Lock the wheelchair.
I lock them.
Okay.
Okay.
And she can stand up, right?
You can stand up.
Okay, so you don't have to remove the armrest. Remember, the armrest
Yeah.
can be removable, so
Well,
if those
she
people cannot stand up,
And if we will use that, right?
yeah,
Okay.
or modify, they cannot stand up, you just have to more of max mod assist. She cannot stand up and you have to,
Okay,
okay, provide, she can stand up, remember Mary can stand
but you
up.
gotta help Millie a little bit too.
Yeah.
Okay, so mod assist, okay?
Okay.
Okay, Millie, you gotta help me. You have to tell her so that she will not go like automatic hand to your arm, your neck.
Okay.
Okay, push down. And a count of, you have to remember,
Yeah, you
count
have to
of
get
three. 1, 2, 3, up. Okay, let's turn around.
Hold here.
Millie don't want that much.
Okay,
Alright.
so Millie Wampler. Okay, good. And make sure you remember their footing, okay? Because their legs, they have to have their feet apart too, in the preparation of going that way. Because like this, you're gonna sit, stand,
Yeah.
and turn and sit down, okay? And then for the caregiver, what you gonna do? You have to watch your back, okay? We have our personal space and all that, but you gotta get close.
Yeah.
We're not gonna face the face.
Right.
But your legs, okay? Your legs are slightly bent.
Yeah.
Okay, not stuck up like that.
Okay.
And then the blocking is only good for those that buckle, the stroke or something. So, because if you block it and they're able to stand up, you're in a way for them. That limits them to move. But for those stroke that they will not have any, that's when you use the blocking, okay? If this is the leg that just like buckle, and where this leg buckles, that's the one that you're gonna brace on with your, and then, okay, the count of 3, we're gonna stand up and you have to tell them what we're about to do,
Okay.
so that they will like, okay, we're going to the bathroom, we're gonna go to the wheelchair, we're gonna get up, okay? You're gonna lean forward, we're gonna get up, okay, put your hands. If she's a gripper, I would let her reach out here.
This one first.
Farthest, not here, because once you get there, you'll be stuck. Okay, the farthest one, and I count of 3, we're gonna stand up nearly, okay? 1, 2, 3, up! And while you're bracing, there, okay. So your legs should not be entangled with her, and you have all that number. It should be clear in the process of getting there, okay, and that. Okay, slightly over. If you're back neutral, not look this or back this way, because you're gonna lose your stability. Your center of gravity will be lost. Okay. All right, Millie Polari. Millie have her own story, so
I'll be talking away.
how you gonna tell her?
That too, doing that right now.
Millie doesn't. You have your own story. She got her own story. I'm like, Millie, you gotta get there. You still have to cue her in some other way. How you gonna make it happen?
I'm gonna be Millie.
Okay, Millie.
Millie,
Memory.
1, 2, 3.
I call her Lady Gaga.
Millie's always be talking to herself, talking away.
we'll talk for a while.
Okay.
Okay. All right, the wheelchair. You're going from which one? Are you in the bed? You're in the wheelchair? Going to bed?
Oh, she's in the wheelchair going to bed.
Okay.
Right?
Yeah.
So-
Millie, you got both legs. Good and not good in so many. She just do her own thing. So, okay. Make sure her wheelchair is, the footrest are out. I don't know if she is footrest. Okay, what else you gotta check before you get up? In the
make sure it's
wheelchair.
locked.
Locked, okay. And Millie can stand up. You just have to guide her and look at her feet. Millie feet is,
Right. Crust.
look at her feet. Are you ready to?
Let me help.
She has to figure it out.
Yeah.
You're Millie.
Put your
So-
feet back, yeah.
Okay, so put your feet apart.
You have to do it, Millie.
I'm being Millie right
Guide her, Millie, Millie.
Just looking off into the middle distance between me and Miriam.
It's 100% she pretend like Millie. Okay, Millie, you gotta lean forward. Then the forward is cueing you where you're going. Because sometimes it will lurch back.
Okay, so lean forward for me, Lily.
No, we're not doing that.
I think this is gonna be the challenge, guys. We won't sing and dance, we'll just do our imitation.
Her own thing. So if you happen to see her, you gotta make her do it.
Okay.
And sometimes like you guide them, like touching, okay, Millie, okay, going like that. You kinda like, you gotta lean forward, Millie, and then you put under. So your hand placement can encourage them what they gotta do or something. And they're like, we're good here, Millie. You know, come on. Alright, put your hands right here,
We're gonna
Lily.
transfer the count of
You're gonna-
three. Okay.
To kind of guide her to get
Okay.
there.
Okay, so
I
we're
got
gonna
it
count.
three.
Count of three.
Come on, Millie.
She's being Millie on a really difficult day.
No, come on, let me stop.
Okay, you ready? Okay, one.
Lean forward,
Put your
Millie.
hand there, lean forward. Okay, we're gonna go with the count of three. 1, 2, 3.
Okay.
Good job.
And then turn around. You gotta cue them. Turn around. Ease on down. Okay. Always cueing. Okay. Because so you know you'll be on the same wavelength.
Right.
She will go with what you're telling her to do. Not like I'm free what I'm gonna do. So you're in the same page.
Right.
So that's the thing with transfers, okay? And
Millie should be all everywhere.
and for what's her name? What time is it? So it serves her caregiver too. The difficult one, Miss Judy. Judy don't have sitting balance, but Judy she tighten up, but you have to like get her to relax, because eventually, because if she get she will just she will do like this, she will curl up like a whatever. So you're gonna loosen her up. Sometimes rocking or touching them. If she's in the bed and she's, I don't know, she might be like this. So you kind of like touch her, make her like comfortable.
Her head
You know,
helps too.
because the legs, you know, if she's so stiff, it'll be hard. So I rock her legs, you know, things like that. Because she's still way over there. You know, you cannot let go of her. When she let go, she'll be in the bed. So we're still working on trunk. We had to get neutral to be able to go like the flexion part. She's still 45 degrees off from midline. So that's what I'm working on. And then in her wheelchair is already reclined. It also facilitates like she's in the bed, same thing. So as much as possible when I'm working with it, I kind of get it forward. And she has tendency of sacral seating too. I mean, her butt is almost off the, so just imagine that this space is, you know, missing, and where the weight is in that area. So if she can tell you, she's hurting on that area. So as much as possible, if we got, or even us, we have to get our butt to the edge of that, you know, to have that even support. Our weight should be even distributed here, not just on the tailbone or whatever. Okay, so with her, bed mobility, you know, trying to get to that point of transitioning from laying down to getting up is I'm doing range of motion to kind of work with her legs. And when you can put both her legs like that and do like this side to side with her hips, that will facilitate of the turning, okay, with the hip flexion and then turn. Because where your head is there, if in extended position, your whole body stiffen up that way too. So if we could get this like a little bit here and then this, and then it's not gonna happen instantly, get it to that flexion part. And same thing with the hands. Once your hands are tucked like this, you know, a lot of it has a synergy. It's more of flexion of fingers, flexion of the wrist, flexion of everything. So to get it into extension is you have to get the thumb out. No matter how much you cannot, once the thumb is in, it is so hard. And sometimes those that's contracted already, they have sores here and it stinks like crazy. And then, so as much as possible, we get the thumb out. You gotta get the thumb out like this, pull it out, and then work your fingers out. Some of them might have OT to work with a splint or something, but if it with splints, we have to check of skin because they could have like sores. And then for the wrist, you work from here. So if they are tight from shoulder all the way here, start with the farthest part of your limb. Okay, start with your hands first. Like that, if you get that working out like this. And then comes, get it extended like that, then work on the elbow. okay? Extension. At first, might be probably this much to move, but as you know, rubbing the muscle, creating it to relax or something like that. And certain way also that you touch the muscle, touch the skin, because if it's, that's facilitation, it will draw them back, okay? If you put a little bit of pressure and do it slow, that creates, you know, relaxation, okay? And then they will give in and it will like bend and you can get more of the range, okay? That's what we're working on, the contractor, whatever, management on Judy, because she is joining up. We don't want it to be where we cannot stretch it. It's still stretchable, but it takes a while. So, and then here comes the elbow. Coming out this way, and the shoulder, okay? With the normal range of the shoulder, when you go like this, there is a movement of our joint, because the shoulder is not the same as the hip. The hip is a ball and socket, okay? So it can go all directions. The shoulder is very important because weakness, with their age, arthritis and everything, so many things happening here. So when we are lifting from their shoulder, especially those frail, not so muscular, we could dislocate their shoulder, because this is made of three bones: the clavicle, this is your collarbone, this is your scapula, so they meet kind of like that, and then your head of your humerus, and in certain angle, the 90 degrees, they have to rotate so you go further that way. So when you're doing range of motion with whoever, just make sure that the thumb is facing that way, okay, towards the ceiling, not going this way, because something like, okay, there is, in that range, there should be an internal rotation that it goes up to 180 degrees. So it'll go up that way. So when you go abduction, it will just go further like 90 degrees. You can abduction without turning your body because it just limits there. So you're gonna internal rotate to go up. So abduction is limited only to 90, and then there should be internal rotation to happen so that you get the full range of going like that. So the hip is a bola socket, it goes like, but that's the thing when they're sitting and on that posture, they develop this tightness here. And they get to the point that they're crossing their legs a lot, it'll be hard for you to clean them because you'll be so tight. So what you can do, if it's still not contracted, you know, do that leaning back or, you know, I mean like rocking them side to side, it relaxes here, and then you could open it up, hold it when you're stretching for 10 to 20 seconds, and then also you could do some rubbing here to relax those adductors. And some of them have those abduction cushion, use it, okay? Because what we stretch, if we don't sustain it, it'll go back out like a rubber band. It will recoil back. So those are what we're working on Judy. So Judy is hard for right now, but it can be done. I was able to transfer, but it's max assist, because max a total assist, but a lot of queuing. So yeah, what I do before I get her to bed, I do some range of motion, loosening the knee, the hip, and everything first. At least open it up. Because if you don't, she will be like this, stick out, and you'll be lifting her dead weight. So if she is positioned right, you don't have to lift that. You use your body weight, and then you have to go with but hopefully that we can get into that, that leaning forward and sit pivot, and that's why. So she's kind of like, you still have to do a lot of lifting on her because she go against, but make sure her arms are clear because she is a gripper. She grip hold of you. She didn't want, no matter. You have to put her down and let go of that where she's
Yeah,
holding
remove
you.
her hand.
So she, so that's the goal, is for her to do like that. But I can do her by myself. So what I do is like position her legs, make sure her legs are not under whatever, and then I remove the armrest because she cannot completely do sit stand. It's a modified
Sometimes
sit
she'll
table.
help you. Sometimes she'll stand up. So
Yeah.
there she
So it's like a ever duty
Yeah.
field.
Yeah.
So, and the more you're used to her, she get used to you,
Yeah.
and then she'll cooperate. And it depends what time of the day. The memory, there is no constant thing.
Right.
Their mind change and all that. That's why we have to be aware their characteristics, their sundowning, their whatever. So there are days that we have to vary our treatment time because there are days they cannot cooperate or they'll be aggressive or something. So like, okay, I'll get her loosened up, okay, then put the gate belt. All right, one, still, even if she's not talking or anything, you still provide cueing. 1, 2, 3, let's sit up. 1, turn, and that way, okay? So you transfer her weight to you, you also use your legs, okay? Do not be like, and then the next thing you know, you have pulled your muscles and it takes forever to heal. So that's the transfer part. All right, so we'll go to, we already did the demonstration. Now we go to the durable medical equipment. That includes your hospital bed, your shower chair, your shower bench, your wheelchair. This is wheelchair. The one with 4 wheels, little bitty ones, those are not wheelchair. They call it transport chair. Okay? This one, they can wheel themselves, they can lock and all that. The transport is hard because the lock is in the back of the wheels. So they become, it's hard, but that's not supposed to be where they are supposed to be sitting most of the time. That's just for doctor's appointment, short time.
Somebody has like that.
Yeah, so you might see them, but that's supposed to be just like going to the doctor because it's lighter. They don't have these heavy wheels. So they could fold and get in the trunk quicker, light. But for prolonged use, it's not designed for that one. Because they cannot wheel themselves, and then the brakes is in the back. So they have the hemi walker, it's like a walker, but it's just one side. You have the rolling walker with the 4 wheels or front 2 wheels that has
Tennis balls.
rubber tips or glider. The four-wheeler with a seat is what we call rollator, and then there's a kind of 3, which is not very stable, but they buy it at Costco or Walmart. Everything that they use should have a doctor's order, okay? And it has to be rechecked, monitored, because if they have even a cane, I have a patient that has got like 20 of them because he collects it. When he moves in, he bring everything. And when which one of this is being used? You've got the wooden one, you have the one, the vine looking. So I have to ask the family what needs to stay in his room. Just those, the one he used. So we have to let them know to take it back. And then what else we using? Yeah, there's different kinds of wheelchair also. They have the long reclining wheelchair. So, but those can be adjusted, okay? So if they are just like, they got tired, they want to lean back. But during eating, we encourage them to be upright. Because if they are extended, they are most likely to choke. Can you imagine eating with your like this?
Yeah, Judy is always like that.
So as much as possible, we're trying to get them to sit up neutral sitting, because when we eat, we kind of go on flexion. We do like this. Nobody eats like this, okay? So we're trying to get them, because that's another thing that we prevent is aspiration, okay? Some of them have stroke and everything, and they have dysphagia. And that's why we have to know if those new people that comes, if they have recent stroke, if you notice them choking when they drink water, keep having that and they don't have diagnosis of that yet, you have to alert the nurse. We've been choking with this and that. And for even with the speech therapy, they cannot upgrade or downgrade the diet. They have to be tested for the swallow test. They have to pass that. And some of then they will be the ones like, okay, you have to be nectar, all those kinds of consistency because of the swallowing difficulty. But if you have, and they don't have that, and if you notice they are light drinking and they don't know how to drink and swallow, things like that, you have to let Kim know. Especially those new people, or even the ones that's been here and all of a sudden they're declining or something. So have to take note of that. Because it could be prevented, because it will eventually create pneumonia from aspiration, not the bacterial one that they get it from, the bacteria, but the fluid that goes to the wrong pipe that will cause them to have pneumonia. Another thing also is, which I don't see a lot, but other places, we don't encourage them to stay in bed a lot, because that could accumulate even if they have colds or something, like, I don't want to eat, I just want to stay there. It doesn't take very long for them to develop pneumonia because they're laying flat, there's no drain of the fluid, so as much as possible, even if they're like, let them up in a recliner or something, or the bed up, not flat, okay? But as much as possible, get them out in the bed. The only time, every 24 hours they stay in the bed, they're losing 10% of their strength. So you've seen these people that move in here, they've been in the hospital for 2 weeks, straight bed rest. They could hardly even sit up. They cannot stand up. They weaken. So before they were aggressive of getting people up, but with my friends that been hospitalized, good luck. They don't bathe you. You have to make yourself eat even with all those things. So we don't assume the care that they have long time ago is the same one now. It's short of people since pandemic. So as much as possible, it is for us to continue doing that. Hydration, getting them moving, let them do as much as they can. Because if we will make it a habit, okay, we'll get up, I'll pick you up. I mean, it's bad for them and it's bad for you. Because they will, and then they eat a lot, they gain weight, and they're heavier to lift. So the turnover of the caregivers will be fast. So the goal is we gotta keep our residents happy and healthy so that we have our 40 hours. Because if we don't take care of them and they end up in the hospital, they die, this and that, or even they go in the hospital, they've broken hip, it takes them a while to come back. Sometimes they stay in the rehab for 4 weeks or months or something. So as much as possible, you check them, and also bladder, most of them are incontinent, okay? Like you're training your toddler, every 2 hours you check, okay? That also encourage them to drink, hydrate, and every 2 hours in a habit that, don't wait till it's full, and, that they will change diaper, because that to prevent UTI, because if they sitting on that wet diaper for a long time, bacteria start to, and then develop UTI, and also sores, or pressure sores, skin rashes, and all that. So also for zip swapping on that one. Going back on the DME, make sure that the brakes are in good shape. Like this one, this need to be thrown away. I don't know who can fix. I don't know if you can do parts in the Philippines. They will piece, they will fix it. Replace parts by parts, but I think the parts here is very expensive. It'd be better off buying a whole new one.
I think it can be replaced the weekend.
But where you gonna replace? I don't know. Maybe it will stay in there so nobody will be using it, because with the ombudsman or somebody will see
Do a
it.
little research, see what we can find.
Maybe you can replace something.
Is it
because
just, just the wheels?
Yeah.
The big
It's
wheels,
still
everything
good.
else is okay.
The build is still good.
Yeah.
The frame.
This might be one of those factory defects. I never seen one threading
The
like
that
this.
is in Martha Brothers' room.
It's like the tires that losing the threads, but here it's supposed to be just smooth surfaces, but the body's still good. So if they can switch it to a ruggedy one, I don't know if they have different tires or something, but that's like, okay, so this one is a no-no, replacing that. And then here, when you're cleaning, make sure sometimes hair gets stuck in the wheels or something. So make sure you, I don't know if you wipe it down, some places they pressure wash it. So you can do that one too. And make sure the walkers, those, because they're supposed to be collapsible. You press that thing and it won't be wobbly. Okay, if you see some, what's her name? Miss Lucas, what is she using? Rollator or a rolling walker? Is it with the seat?
Yeah,
Natalie.
Miss Natalie.
Yeah,
I
Natalie,
don't
you
think
have
she
to
sits
make
on it,
sure,
but it's a
make
seat.
sure her brakes, those brakes are working when they press down.
She
'Cause,
just hardly to stand up whenever she eat in the dining table. She's hard to get up. That's her problem.
Just like Miss,
So
remember Miss
make sure
Sandy?
that when they get up and they're reaching on the thing, it's locked. Because
Yeah.
I think that what
Yeah,
happened
it's
with
To
Sandra.
Sandy, yeah.
Sandra, she didn't have it locked, and I think
She
about to
went-
sit down or get up, something like
I
that.
think she was about to get up and it went. and
Yeah.
she got fast.
So those
Stars,
rollators, those brakes has to be in good shape, because sometimes they use it a lot, they go out and everything. And this one, the brake and then I think the wear down of the rubber, it doesn't meet anymore. So there is no locking anymore. It doesn't grip the tire anymore. So it needs to be checked. And the cheaper one, you tell the family, it's cheaper to go to Amazon because in the DME, oh boy. The insurance only cover for the aluminum one with the thing. If they go with the seat and everything, they have to pay $50 on top of the whatever. And you need to have doctor's order to get a new one. Medicare only provide them every 5 years. Okay, one wheelchair or walker or whatever every 5 years. That's why they don't have to give it away, because you ended up going to Salvation Army or thrift store to find you a different one. So, and then the cane, all the rubber tips should be in good shape, because if it's metal, when they bear down in it, it could cause them to fall because they kind of like nothing grips. Okay, so we are down to pressure sores. I don't think anybody has sores right now unless they come from the hospital. So sometimes they be on the bed. And check those coming from the hospital that their heels are not black or red or whatever, because sometimes they wear those shoe socks and nobody looks at it. If you are laying down 24/7 for 7 days, most likely you'll have one. So check those heels and report it too, especially those diabetic ones, because that will start from there.
What?
And eventually,
Why would it be not dirty? Like, why would it be black or red?
because it's going to be a scar. It will be like callous black.
Oh,
Yeah.
Is
Okay.
it like Lynn before? She
Yeah.
had
Yes.
this before?
They
Okay.
have to
so
surgically
Surgery.
take it off.
what's like, is blood settling there like a dead body? You know, the blood settles at the bottom.
Necrotic tissue. It's a dead whatever, but it started from there. Anything that you press that, you know, the redness that they will not come back, that's already stage 1. They don't have to have this opening or
Right.
something. And then the stage 2 is already deeper on the soft tissues and everything. Then stage 3 includes the muscle. Stage 4 is the worst. You don't see it here. They don't allow you to have those
Yeah,
kind
we
of
had
like
that-
bone and
We had
whatever
that
in
before,
there.
you know, Marion.
And
Yes, we
if
have.
they are here, they are under hospice or something, you cannot fix it. I think they will allow you to have like stage 2 under home health, the nurse that will take care of it, or hospice. So, but our thing is prevention from contractures, prevention from pneumonia, UTI, prevention from SARS. So notice those when they come back, because we don't know how long they be in the bed. And here, I know you'll be getting them up, and always check their feet, okay? Because it's a sad thing. I look, oh my gosh. And then report, podiatrist comes every month. Make sure it's in the schedule, okay? Because he's not gonna go, who got this. He don't have that time. So he's got a book there for the appointment, because I don't know if they know when he's coming. He's coming. So make sure when you see them, whoever is bathing them, even those that say they're independent, every now and then check their feet, okay? Because sometimes they'll be like dead skin that, my goodness, you would think I have seen one like, is it like cadaver feet? It was so dry and flaky and everything. Oh my gosh. Because sometimes, you wipe them down, you put your clothes on, and then they don't wipe the feet in between the toes, Those fungus can, from being damp and everything. Make sure you take time with doing that. It's for the care, because if we don't take care of that, they can lose their toes, feet, or whatever. So report whatever you see, especially when you're transitioning from 2 to 3, 3 to whatever. So whatever happened here, you pass it to the next. So, same thing with the medications, whatever, the PRN, just a PRN. But if it goes for so long, Tylenol every day for about a month or something, that could be something else. Okay, so another thing that you probably, infection control, hand washing and all that, it's time for the allergies. This is the time we have COVID, flu, everything is around. So active coughing and everything for our eye hygiene, you could wear, I don't know who wants to wear masks, but hand washing before we touch so-and-so. Even if we don't see the dirt in our hands, make sure we wash our hands, okay? And also DVT, deep venous thrombosis, that's the new thing. It could happen to everyone. Prolonged immobility, okay? You're down in the hospital or something, you have some kind of surgery or whatever, or going on a long trip to the Philippines or somewhere, that could cause, some people landed with blood clots and everything. So if you're traveling, make sure you wear your anti-embolic socks, compression stockings, and move as much as you can. If you're gonna travel, long distance travel in the car, the same way. Get out, bathe, move around as much as possible you can. So those that has surgery or but it could be anybody. When you see them pretty much it could happen also in the arms, but they are in the legs, swollen, painful, red, and that's why we don't encourage, if they have surgery or something in the legs or whatever, to massage, because we don't want any blood clots that goes somewhere else. So if you happen to have DVT, they have a test for that, let the supervisor know so they can, check on that one. Okay? It's painful, being painful to touch, and it's warm to touch, and it's swollen. So report that to the nurse, or
is that
call your doctor if it happens to you or someone or whatever.
Is that like our independent resident,
Yeah,
Mona
the
Lisa's legs?
President that's eating here for lunch.
Yeah.
She's swollen.
And red, and it looks like it's burning on
It's very
fire.
dry.
Yeah, Kim's aware,
Does she
we
have a
don't
doc-
do because they're independent,
I know.
the
but-
doctor's not
But she's
involved, but
supposed to call her doctor.
yes, I know. And
Yeah, 'cause
Kim's
it's like a
Kim's on it.
stroke. Like a long time ago, we have so many stroke patients, but with the public awareness, like You see
Yeah.
the billboard, if you have slurred speech and all that, every minute counts. So the same thing with what we see and observe, we have to let somebody, the supervisor, voice it out. If it happens in your family, if you're a
But
father,
is-
mother, whatever, call their
Is
doctor.
she allowed like that to come here like that?
That's a good
Is
point.
this,
It's a good point.
well, she has to see the doctor, because if it lingers on, if it's
Yeah.
cellulitis, she gotta be on
Big
antibiotic.
feet, very small feet, but the legs is swollen and
Yeah.
reddish.
That could be cellulitis, I don't know.
Yeah.
She has to see
She's-
a
she's got
doctor,
some
because
health
we cannot
issues.
diagnose it. The doctor has to
Yeah.
diagnose it,
Yeah.
get the proper treatment,
Right.
and then, but that's the thing, we see them, we have to tell them. It's up to them to
And
respond.
we have discussed, I believe that it's been discussed with her.
Yeah.
But because she's independent, Dr. Sada's not gonna look at her. You know, we're not getting involved
Does
in
she
her
have any
medical.
family at all?
She does have family
And we have to
here,
alert the family, 'cause
sister
they're the
and
one-
mother, the sister's aware.
If they have to, if she have no transportation, she don't wanna go, or.
She
whatever.
drives.
Oh, she drives.
Not well, but she drives.
Some of them don't need to be in the road,
Yeah.
but they do, but we do everything we can so that we're not like, you know, we're ignoring it or something. They have the right to refuse.
Yes.
That's the patient's
Yeah.
rights. That's why I don't elaborate it much, their patient's rights, because some of their patient's rights to refuse is detrimental to their health, because they are refusing the proper treatment that they need to receive. So that's all the information I'm giving you. Thank you for
Thank
holding
you.
on.
Thank
And
you
you
for
have
the-
the